Just to point out that the gastroesophageal valve actually has three components to it: the intrinsic, which is smooth muscle; the extrinsic, which is the striated muscles of the crura, as well as the pharyngoesophageal ligament. So disruption of any of these compartments can actually lead to gastroesophageal reflux disease. This is an important slide, and the take-home message here is that based on what I just told you, even if you have a normal-looking anatomy, you can still have gastroesophageal reflux disease. The second issue in this slide that it's trying to convey is that the more abnormality you have in your anatomical structures, the more severe gastroesophageal reflux disease you're going to have. And this is, in fact, supported by this study that was presented by Shaheen and Demister at DDW in 2013. What they did was they took about 918 patients with acid reflux. They did a pH study on them and stratified them based on their Demister score, which is the level of reflux, as well as their anatomical deformities. What is staggering here is that about half of those patients, 406 patients, actually had a normal-looking lower esophageal sphincter, but they had an abnormal Demister score. The second observation here was that as you had more and more components being affected, you had more and more reflux, which is a concept that we already know. I'm bringing this slide up again because I really want, if you guys don't get anything from my presentation tonight, I'd like to have this be a take-home message that the earliest issue with gastroesophageal reflux disease that has to be recognized is the fact that it's the dynamic failure of the lower esophageal sphincter. You do not have to have a whopping huge hiatal hernia in order for you to have acid reflux. You can have a normal looking valve and still have significant reflux and symptomatic reflux. This brings up the next slide. I'm sure a lot of you already know about this. I don't have to belabor it, but GERD is a clinically progressive disease. What we really need to recognize is at early stages, we need to make sure that we recognize patients that have gastroesophageal reflux disease and mild symptoms, and don't just give them PPIs and essentially put a Band-Aid on their symptoms. Because as time goes on, and if we do not correct the actual problem, patients will eventually develop complications, some of which can be irreversible.